Death is one of the few certainties of life, but many of us avoid thinking or talking about it. However, have you ever wondered what it would be like to be just 24 hours away from this inevitable moment? More than that, have you considered that there are subtle signs that may indicate when the end is near? In this video, we will explore a delicate and fascinating topic, the 7 signs that suggest someone may be approaching death. Before we begin, keep in mind that these signs do not always guarantee an imminent death, but they are important indicators that the body is preparing for its final transition. If you are concerned about a loved one or simply want to understand the cycle of life better, stay with me until the end to learn more about this process and how to face it in a more conscious and compassionate way. The first sign is something many of us have observed in someone who is in the final stages of life: increased sleep. As the body approaches its end, metabolism slows down significantly, reducing the energy available for daily activities. This causes the person to sleep more and have less energy for interaction or movement. This extreme fatigue can be an indication that the journey is nearing its end. It's common to see the person experiencing muscle weakness and the inability to perform even the simplest tasks, like getting out of bed. Prolonged sleep might seem like rest, but it's actually a sign that the body is conserving energy for basic functions. It's essential to pay attention to this, as in the final days, the person might not be able to get up or even communicate. The second sign that many people report is somewhat curious and sometimes unsettling: hallucinations. People close to death often report seeing deceased loved ones, unfamiliar places, or even otherworldly experiences. This might seem like a spiritual journey to some, but it's actually a chemical response in the brain, which starts releasing substances that affect perception. During these moments, it's important not to contradict or correct the person about what they are seeing or hearing. Instead, ask gentle questions and listen attentively, offering a safe space where they can share their visions without fear of judgment. Hallucinations may be confusing, but they can also provide comfort to the dying person, making them feel connected to something beyond the earthly life. The third sign we will address is pain. As the body nears its final moments, the intensity of pain can increase significantly. Muscle spasms, grimaces, and groans of pain become more frequent, and often, painkillers that worked before may no longer be effective. To ease this suffering, medical care needs to be intensified, whether at home with a nursing team or in a hospital with stronger treatments, such as administering medication intravenously. Many people lose the ability to swallow, making the use of feeding tubes necessary to ensure that medication is properly absorbed. Caregivers and family members must be prepared for these changes and seek ways to minimize pain, as the goal at this stage is to provide as much comfort as possible. These 3 signs are the first indicators that the body is preparing for death, an inevitable and natural process. By recognizing these signs, we can offer more support and care to those in their final moments, making this experience a bit smoother for everyone involved. Stay with me, as in the next part, we will explore more signs that indicate the approach of death and how to deal with each of them in a practical and compassionate way. Let's continue delving into the signs that the body exhibits as death approaches. We've already discussed increased sleep, hallucinations, and growing pain. Now, let's cover more visible signs that reveal the body's deterioration and how this affects the individual and those around them. These signs may seem unsettling, but understanding them can help us handle this inevitable phase of life with greater empathy and preparation. The fourth sign is a change in the body's vital signs. As death draws near, vital organs like the heart, kidneys, and lungs begin to slow down. This results in noticeable changes, such as low blood pressure and irregular heartbeats. Blood circulation, which is usually evenly distributed throughout the body, starts to focus on the most essential organs for immediate survival. This means that areas like the hands, feet, and legs receive less blood, making these parts cold and sometimes bluish. The skin may show purplish blotches, indicating that blood is not circulating properly. Another visible change is the color of urine, which may turn brown or tea-colored, indicating that the kidneys are not effectively filtering the body's toxins. The ability to eat and drink also declines drastically, leading to a loss of appetite and, consequently, a reduction in bowel movements. The fifth sign, which can be emotionally challenging for friends and family, is the withdrawal of the dying person. As death nears, it's common for the person to begin socially disengaging, preferring silence and isolation. Conversations become shorter and less frequent, and responses may be slow or even absent. This behavior can be a reflection of low energy and an unconscious instinct to prepare for the next phase. This withdrawal doesn't mean a lack of love or appreciation for loved ones. Rather, it's a natural process of retreat. It's important to respect this space while still being present when the person desires company. Sitting quietly, holding their hand, or simply being nearby can provide great comfort. If you've experienced this before, you know that these moments of silent closeness can be precious. The sixth sign is breathing difficulty, often one of the most distressing for those witnessing the person's decline. Altered breathing patterns are common, including shorter, gasping breaths followed by longer pauses. This phenomenon is known as Cheyne-Stokes respiration, characterized by cycles of rapid, shallow breathing followed by longer pauses. It can be alarming for family members, but it's important to understand that, most of the time, the person is not aware of this discomfort. Pain and anxiety medication can help ease breathing, so it's essential to speak with the medical or nursing team to ensure the patient is as comfortable as possible. It may seem like the person is struggling to breathe, but this is simply another sign that the body is in its final stages. These signs clearly indicate that the body is gradually shutting down. They can be hard to witness, but understanding what is happening helps provide better quality of care and presence during this critical moment. For many, the proximity of death is a moment of reflection and reconciliation, both for the departing individual and those who remain. By understanding these signs, you will be better prepared to handle the changes and help your loved one experience a more peaceful transition. We have reached the last part of this script, where we will discuss the final signs and the most subtle changes that occur in the body during the last hours of life. Talking about this can be emotionally challenging, but it's essential to understand the natural process that everyone will face. These moments can be full of meaning, and knowing how to act can bring great comfort to the dying person and their loved ones. The seventh and final sign is the inability to open the eyes. In the final stages of life, the body's muscles, including those controlling the eyelids, become extremely weak. The eyes may remain partially closed or closed altogether, and the person may no longer be able to keep them open. Additionally, the eye's color may become dull, and the expression may seem distant or vacant. This is a clear sign that the body is preparing for the final transition. Many believe that the eyes are the window to the soul, and this gradual closing symbolizes the detachment from the physical world. If you are by a loved one's side during these moments, continue speaking to them, even if their eyes are closed. Studies suggest that hearing is the last sense to fade, so your words of love and affection can still be heard and appreciated. Now that you know the 7 signs that death is near, it's important to remember that each person experiences this process uniquely. Some may show all these signs, while others may only exhibit a few. Regardless of how it unfolds, the most important thing is to provide an environment of care and dignity. Be present, but don't forget to also take care of yourself, whether you're a caregiver, a family member, or a friend. Facing the imminent loss of someone can be a moment of great learning and reflection. It is an opportunity to honor shared memories, express love, and find peace in knowing that you did your best to be present in the person's final moments. The grief that follows the death of a loved one is a natural and personal process. Allow yourself to feel all the emotions that arise, and don't hesitate to seek support, whether from friends, family, grief groups, or mental health professionals. If this video was helpful to you, please leave a like and share it with others who might be going through similar situations. And subscribe to our channel for more content like this, which offers information, comfort, and understanding about life and death. We are in this journey together, and with knowledge and mutual support, we can face this natural cycle in a more welcoming way. Thank you for watching, and remember, life is short, so make the most of every moment with those you love.